Most men believe oral sex carries no real health risk for them, but infections don't always announce themselves right away. Sometimes inflammation begins in areas you can't see. Sometimes bacteria settle quietly, and sometimes by the time discomfort appears, the exposure happened weeks ago. Silence doesn't mean safety. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and here on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. In this video, I'll walk you through the health risks associated with oral sex that most men are never told about, why symptoms may be delayed or subtle, and how awareness can help you make safer, more informed decisions. Your urethra, the tube that carries urine and semen out of the body, is not a sealed system. It opens to the outside world, which makes it vulnerable. The lining inside is delicate. It relies on normal urination and the body's natural defense mechanisms to stay healthy. But when foreign bacteria or viruses enter through sexual contact, especially oral exposure, the body doesn't always react immediately. In India, many men delay medical consultations because of embarrassment or lack of awareness. As a result, early signs of infection can go unnoticed for weeks. The mouth carries its own bacteria. Some of it is harmless in the oral environment, but when introduced into the urethra or genital area, it can trigger inflammation, irritation, or infection. Because symptoms don't always appear right away, many men assume nothing happened, but the body may already be responding. One important risk involves bacterial transfer from the oral cavity. The human mouth contains hundreds of bacterial species that normally cause no harm where they live. The urethra, however, is not designed to handle that same microbial load. During oral sex, bacteria from the mouth, tongue, or throat can be transferred directly into the urethral opening or onto the skin of the penis. This can lead to inflammation of the urethra, sometimes called non-gonococcal urethritis. Symptoms may include mild burning during urination, slight discharge, or a feeling of irritation that comes and goes. Many men dismiss this as temporary discomfort and expect it to resolve on its own. Sometimes it does, but sometimes it lingers, quietly damaging the urethral lining and making future infections more likely. Another risk involves viral transmission. Viruses such as herpes simplex can be transmitted through oral contact even when no visible sores are present. The virus may remain dormant in the body for months or even years before symptoms appear. When it does activate, men may experience blisters, itching, or burning sensations. What many men don't realize is that the first outbreak often doesn't happen right after exposure. It may appear later, during periods of stress, illness, or reduced immunity. In India, where work pressure, financial stress, and family responsibilities are common, viral reactivation is often triggered without men understanding the connection. Human papillomavirus, or HPV, is another concern. Some strains can cause genital warts. Others are linked to cellular changes that may increase cancer risk over time. HPV is often asymptomatic, meaning a man may carry it without knowing. But transmission can still occur, and over years, untreated infection may contribute to more serious conditions, including penile or throat cancer. These risks are not immediate, but they are cumulative. Throat infections can also be transferred to the genital area. If a partner has a sore throat, strep infection, or even a recent upper respiratory infection, bacteria or viruses from that infection may be transferred during oral sex. Certain bacteria, such as streptococcus, can cause urethral inflammation if introduced into the genital tract. Many men don't connect a partner's recent throat infection with genital discomfort that appears days later, but the body doesn't separate infections the way we assume it does. Microbes move, and intimate contact creates pathways. One of the most concerning aspects of sexually transmitted infections is that many produce no symptoms at all, especially in men. Infections such as chlamydia or gonorrhea may cause no noticeable signs in the early stages, even when transmitted through oral sex. Without symptoms, these infections can still travel deeper into the reproductive system. They may reach the epididymis, cause swelling or pain, or contribute to chronic pelvic discomfort. Over time, untreated infections can lead to scarring, reduced fertility, or complications that require long-term medical care. In India, where routine sexual health screening is uncommon and many men avoid discussing symptoms, these infections often remain undiagnosed until complications force medical attention. By that point, damage may already be present. Repeated exposure to oral bacteria or viruses can also affect the local immune response in the genital area. The body may begin to treat low-grade inflammation as normal. Over time, this can lead to chronic irritation, recurrent discomfort, or increased susceptibility to future infections. Men may notice symptoms that come and go, feeling fine for weeks and then experiencing flare-ups after sexual activity. This pattern is often dismissed as coincidence, but it usually isn't. It's the body trying to manage an ongoing challenge it was never designed to handle repeatedly. If you're hearing this and feeling concerned, that's understandable. But concern is not the same as panic. These risks are real, and they are also manageable. Awareness is the first step. Knowing what can happen allows you to make more informed choices about protection, communication with partners, and when to seek medical advice. Many infections are treatable, and many symptoms resolve with proper care. The goal here is not fear, but understanding. Every body is different. Symptoms can have multiple causes. What I've described may not apply to every man, and not every infection or discomfort comes from oral sex. This content is educational and does not replace medical evaluation. If you experience persistent symptoms, unusual discharge, pain, or anything that concerns you, consult a healthcare provider. Seeking help is a sign of responsibility, not weakness. Now let me ask you a question. How often do men consider the health of their partner's mouth or throat before intimate contact? It's not something most people think about, but perhaps it should be. If this video gave you a new perspective, feel free to share your thoughts in the comments. Your experience may help someone else recognize something they've been ignoring. And if you found this useful, consider subscribing. In the next video, I'll explain how chronic low-grade inflammation in the genital area may be affecting your urinary health, your sexual function, and even your long-term prostate risk without you ever noticing clear symptoms. It's something many men discover too late. I'll see you there.